Clinical Pearls, brought to you by Medicom Oncology.
Welcome to Managing MDS. Hi, I'm Dr. Stuart Goldberg. I'd like to briefly review with you predictors of response to lenalidomide in the non-del(5q) MDS patient. For the last 10 years, we've all known that patients who are transfusion-dependent, low-grade disease who harbor a abnormality of deletion 5q, lenalidomide, an oral agent, can result in 2/3 of these patients becoming transfusion independent within only 2 to 3 months. But what about the patient who does not have a 5q abnormality? Can we use lenalidomide in these transfusion-dependent, low-grade patients? And the answer is coming from some clinical trials. The MDS 005 trial, which was reported recently by Dr. Santini in the Journal of Clinical Oncology, randomized patients who had failed erythropoietin or were intolerant of erythropoietin, who had low-grade disease and were transfusion-dependent, who did not have a 5q. And what they noticed was that about 29% of patients would have a response, become transfusion-independent, or develop clinical benefit from the lenalidomide. The doses were 10 milligrams daily or 5 milligrams daily in those patients who had thrombocytopenia, and something new, those patients who also had renal insufficiency. In the study, it was found that in general, the medication was well tolerated, with cytopenias being the main reason the patients came off trial. Something else that was important, though, and was reported at this year's American Society of Hematology meeting, was keeping patients on treatment increased the ability to have a response. So for those patients who were developing a cytopenia, rather than just such as neutropenia or thrombocytopenia, rather than just stopping the medication, moving on, if you lower the dose from 10 milligrams to 5 milligrams, or if you started spreading out the dose, missing days here and there, cutting the dose, those patients who remained on therapy derived additional benefit. So we now can look at the patient who has non-5q and think that about 29 to 30% of them may respond in the red cells if we keep them on lower dose lenalidomide for a longer period of time. It may give us a new option before we move on to the demethylating agents. Thank you for listening.
Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingmds.com for more practice resources.